I want to go through this past year. We got to remember the timeline. This virus was detected on December 31st of last year, not even a year ago. Its genetic sequence was shared in January. The first clinical trial started in April, and here we are in December with a vaccine being delivered. As a person who has spent their entire professional life working on infectious diseases, how would you describe what we're seeing today and the effort it took to get us here?
Well, first of all, Stephanie, welcome back. We're glad that you're with us again. Thank you very much. In that note, I think you can personally attest to the critical importance of trying to deal with this disease as we have. We've dealt with it with science. And what you're seeing today is the fruits of those science. Private companies, academic researchers, and a number of seasoned government research employees, people who have actually been at the leading edge of what we call regulatory science, how to bring these vaccines through safely and effectively. And I think it really is a moment for us to understand the power of science. And I'm confident that as the days go on, this power of science can win over the evil of this virus.
The power of science. We've always got time to talk about that. How about the states? Are they ready for this? Do they have the money, the resources that it takes to distribute it?
You know, the states are not, and I'm in touch with them frequently. I come from a long state experience, and unfortunately, this is going to be a link that is going to be at best fragile. In order to get the vaccines out, you have to have people who are trained. You have to have the resources to make that happen. You have to have the information that you can give to the public that will help them understand why they want the vaccine, what they can expect in terms of the safety issues, the effectiveness issues. And that right now, I think, is our weakest link, and we really need to do whatever we can to shore that up as soon as possible.
Secretary Azar was on the Today Show with our colleagues this morning, and he said the general population could expect to be walking into a CVS or a Walgreens to get their shots by the end of March, you know, kind of flu vaccine style. Do you think that's realistic?
You know, I don't know. I can't comment directly because I don't have access to the kind of information that he has. You know, the Biden-Harris transition team has already made it clear that they're looking for, in that first 100 days, to have a major rollout of vaccine. I support their numbers. I think that they surely have a good inside view on this. So I think we can make a dent in this issue in a big way. But we do also have to set expectations. You know, I, for one, am one of those that are going to be very impatient to get my vaccine, but I can't step one step in front of when it's my turn. And I think we'll see for the next several months a lot of people wanting the vaccine who aren't going to be able to get it because of just the time it takes to roll it out. And so that's where I think it's really important we manage expectations that as much vaccine as possibly can be produced is getting out effectively and quickly.
As we said, you're on the Biden-Harris team. What are you most concerned about in terms of taking over this effort while it's already underway?
Well, I can't speak for the Biden-Harris team. I'm just one member of an advisory board. But I do know that the transition team has the expertise to actually understand what is currently available through the current administration's efforts and then what needs to be done after that. So I'm confident that on January 20th, the new administration will hit the ground running with this vaccine issue in regards to the number of doses available, how it's being manufactured, how it's getting out to the public. And I'm confident that that will be an effectively run program.
When do you think we will start seeing the trajectory of cases and deaths in this country being impacted by the number of people who are getting vaccine? Because right now, people are sick and dying.
Well, you know, I will go so far as to say, why do we have to wait until the vaccines get here? You know, right now we're heading into the holiday season. I worry very much about the transmission we'll see there, just as we're coming off of the Thanksgiving season, and we see an incredible number of cases coming out of those events that took place in everyone's homes. So, I mean, my first message right now is please understand, you know, if you have a situation in your home where you have outside members of the family, people who haven't been bubbled up or quarantined for 10 to 14 days, you know, you might not have grandpa and grandma or mom and dad again here next year for Christmas if we don't prevent the transmission from those settings. And so that's the first step. The second step, as you said, what can we do in terms of vaccine itself? Remember, the first line we're trying to protect right now are healthcare workers and those residents of long-term care facilities. We could really have a big impact on the number of deaths in this country quickly if long-term care facilities have a rapid uptake of the vaccine, because that's where a lot of the deaths have been. Also, from a healthcare worker standpoint, we surely can provide better care to those patients who have COVID-19 because healthcare workers themselves are able to go to work. So I think that's where we're going to really see the first big impact.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.